to take appropriate steps. For this, our pilot show, we will be broaching a difficult topic, yet one that demands our attention: sexually transmitted diseases, or STDs. Some STDs you may know by name, such as syphilis, AIDS, or herpes. Yet you may be surprised to know that over 30 STDs have been identified. STDs run the gamut from uncomfortable to fatal, and the physical distress associated with STDs can be tremendous, from blindness, birth defects, heart disease, and much more. STDs impact the physical and social environments of the patient, and they strike across class lines, across race lines, and without regard to sexual preference. In the United States alone, an estimated 20 million people are stricken with a sexually transmitted disease each year. That's an average of one person every 1.5 seconds. Approximately half of all of those stricken are under the age of 20, and tragically, nearly 2.5 million teenagers are stricken with an STD every year. With me today are Dr. Deborah Brown from Northlake Pediatrics, Christy Briggs, and Kenny Carmichael from Tahoe Truckee High School. Dr. Brown, these numbers are staggering. As I did the research for this, I was very amazed at the high numbers of incidents. How does Truckee measure up against the national averages? Do we have an average rate of incidence?
In general, our incidence is similar to statistics, at least for California. We are slightly lower, but the types of diseases that are diagnosed are the same, with the incidence, with the most common being first, chlamydia is the most common, and papillomavirus and hepatitis B, and then following with gonorrhea, syphilis, and AIDS.
And these numbers are actually county numbers, not specific to the town of Truckee?
Some of these numbers were from the town of Truckee,
Mm-hmm.
yes. In general, though, they go by the Nevada County numbers. Yeah.
How effective are diagnostic methods these days? If somebody suspects they have an STD and they come to a physician for a test, are they pretty assured of getting an accurate readout?
Yes, we have very specific tests for these type of diseases. It is very important that you come in for this testing, because you can be asymptomatic when you're carrying these types of diseases, and so it would be recommended because we can diagnose these early before they cause problems.
Well, perhaps we can touch on that then for a moment when you discuss asymptomatic patients, especially with the onset of AIDS in the last decade or decade and a half. There are probably a good number of people running around with an STD, maybe AIDS, maybe a different kind of STD, that don't know it. They're asymptomatic and they don't go in to get tested. Can you expand on the type of numbers we might be looking at here?
Well, we know that HIV, you can be asymptomatic for up to 10 years after contracting the virus, and you can give the virus to other people at that time that you are carrying the virus without symptoms. And then for diseases like chlamydia, the percentages can go up to as high as 40% in women that you are asymptomatic, although it is causing irreparable damage to your reproductive tract. And then gonorrhea as well can be asymptomatic in women especially. Human papillomavirus as well. So many of the diseases are asymptomatic, or you're just slightly uncomfortable and may not suspect you have a problem. So anyone who's sexually active should be getting regular exams and testing for these type of diseases.
So the risk of contracting an STD from somebody that you think is perfectly healthy is still there. The risk exists even if you don't
Yes.
have symptoms.
Yes.
Okay. With us today also are two students from Tahoe Truckee High School. I introduced them earlier. Our audience at this point that while we do have teens on the panel from the high school, STDs can strike any age, and anybody that's sexually active should be heeding the information that we're going to be providing today. Christy, I'd like to start with you, if I may. In the high school paper, you were in charge of or edited a series of articles on STDs. Can you tell us a little bit about your experience researching that information, first of all?
Wow. Yeah, researching it, you find there's a lot more in-depth things. When you find, we went through the hospital to get pamphlets and stuff, and that there's a lot more in-depth symptoms and things that aren't discussed through the state requirements through school, or through, a lot of our parents don't know have never had the education, so don't know to tell us what it is. And it's a lot of this stuff surprised me with what the overall damage that can happen, and it's just, I think there's a lot of stuff that kids don't know and aren't being taught.
So let's discuss that for a little bit. And Kenny, I'd appreciate your input on this as well. As far as the curriculum goes, are you getting some information on?
Yeah, there's some information, but it's in, when you're in a classroom situation, it's hard for a teacher to go into detail about STDs when it's an adult talking to kids, and it's hard for kids to feel comfortable asking in front of 30 other students any in-depth question.
Kenny, do you find that's true? Do you?
Yeah, it
Yes.
is. Most of the education we get is like word of mouth instead of more through the school because they just go over the basic, the basic what you need to know, and not too much about everything that goes on and what happens when you're on the spot and stuff.
And not to lay the whole burden on the schools, there's should be home education involved in this as well. And
Yeah.
do you think the kids in school are learning about any of this at home?
I think some kids are, but I think a lot of our parents aren't educated as to what can happen. And they never had the education, and it's an awkward position for them to go to the hospital or seek the education so they can talk to their kids about it.
Dr. Brown, that brings me back to you or the kids that you're seeing. Are they well versed in STDs? Do they have some information but missing pieces of the puzzle?
Well, unfortunately, we don't see a lot of teenagers in our office. I'm in pediatric office, although we are trained to care for kids up to the age of 18 and are very open to discussing these problems with teenagers. I try to discuss that when I see some of my patients for physical exams in that setting, and I find that they're fairly knowledgeable, but I don't think they're getting their knowledge from home. And I think that it may be a different situation now for parents. I mean, for teenagers now compared to parents when they were teenagers. There's more diseases, the incidence is higher, the risks are higher. So.
And I'm stabbing at this, but I'm assuming that the sexual activity is greater.
Yes, the activity is greater, and it is continually showing that adolescents are having sexual activity at an earlier age. The statistics show that over 75% of women have had sexual intercourse by the age of 20, and that males by 85% by the age of 20. And so and then the age is becoming younger when they have their first sexual contact.
Well, probably one of the questions parents struggle with is, at what age do I begin to talk to my children about this? Can you approach that for us? What's an appropriate age to start discussing?
I think the appropriate age would be at the onset of puberty, which would be anywhere from 9 to 12 years of age. So when you see your child developing sexual characteristics consistent with puberty, it would be a time that you need to address this.
Abstinence is certainly a choice that kids can make. I think that there's a certain amount of pressure out there in the schools, and Kenny, maybe you can address that. How great is the peer pressure, if in fact it exists at all, to be sexually active?
Well, it's not more or less the peer pressure, it's more yourself. Like, you want to go out and try it, or abstinence always brought up, but everyone just wants to, they don't know about it, so they want to go out
Curiosity
themselves.
sets in.
It's a lot.
And Christy?
I think it has a lot to do with what groups you hang out with, because there's the groups that are just like, no, we don't have to do it, and support each other in the abstinence. But there's also others where it's, I think people feel uncomfortable when they're around a group of their friends who are all talking about sex and talking about, they did this with that person or anything else, and they want to be part of that. They want to be part of that discussion because it's like, I don't know, the friend bonding thing. And it's hard for them to stand up and say, no, I'm not going to do it when their group is
And
doing it.
Want to have that shared experience.
It's like they feel left out and don't.
It's been a while since I was a teenager, but I do recall that sense of immortality as though I were bulletproof. I didn't matter how fast I raced around in my car, I was totally impervious to any damage that might happen to me. Now that I'm older, I realize that that's not the case. Do you think kids in school still have that kind of sense of immortality, of being bulletproof, and do you think that's one reason why STDs may be such a problem for us?
Yeah, because most of the kids haven't experienced life and stuff, and the consequences of all the diseases going around, and it's hard to say.
Do you think that that kids in school think there are diseases in their school?
No,
They don't think
people
so.
shine that off like
Yeah.
it can't happen to my. It's
Yeah.
always it can't happen to me, can't
Yeah, it's
happen to
not
my
here.
school.
Yeah.
It's not.
I think it has to do with Truckee being a small town,
Yeah.
is
Mhm.
it with and which is in a lot of aspects people feel that that's never going to happen here. There aren't diseases in Truckee. It's a small town, which really, in my personal opinion, I think is exactly the opposite because it's a small town, and in a school like this, people. I mean, there's a lot of. It's a small group of kids that are sleeping with each other off and on, and
Do
to
you
me
think-
that would mean a higher rate of disease if it could get passed around more
Do you-
easily.
And do you think that kids may have contact with people outside of the school?
Oh,
People
definitely.
visiting the area?
Definitely.
See, that's one of the problems.
Coming in from out of town.
Yeah, we have a very big population that is transient in our town
Mhm.
and can bring things into our community.
A large portion of people, I think, don't really understand that the statistics that you just shared with us today really do exist. I don't think that it's specific to teenagers that we kind of deny that there's any problem. It's a lot easier to hide our head in the sand, as it were, and deny that there's a problem, and yet the numbers reflect that indeed there is a problem. How do we go about changing that? I think, Christy, part of what you brought to the forefront with your articles was information that you could share with the rest of the students in school. How else can we get the message out there to your peers in school and to perhaps your parents and their friends that there is a problem here?
That's tough because most of the kids don't. Most of my friends like don't even pay attention to it. They like think they know everything about it already. Because all the talk about AIDS and stuff, AIDS has been pounded into us for years now, and they just think they know it, like all the information that's need to be known. So it's kind of hard to tell them more and get it.
So you think even if we had all the numbers out there in the world about birth rates and
Yeah.
sexually transmitted diseases, that people would still...
I think there's a small group of people that it would affect. It would change their opinion, but I think that if kids or anybody for that matter is under in the mindset that they're going to go have sex, they're going to go do it. I think it would have effect on the people who are borderline.
Mhm.
And it's hard to say what you could do. I mean, you could have classes for parents, you could have stuff in the paper, all sorts of stuff to get people educated, and it's still going to be a small number that goes and that cares enough to find out.
And that are affected by the information. Well, Dr. Brown, perhaps you can address that. If we can't prevent the act of sex and the sexual activity from going on, then are there more accurate methods of educating or more effective methods of educating people so that they practice safer sex versus abstinence?
I think that if parents talk to their children, that is supposed to be one of the most effective means of educating your child, is feeling comfortable and getting the facts and talking to them and making them feel comfortable that they can talk to you. But the schools are a very important resource as well because they can present the facts, and it's in a setting where it does seem more factual and it's not so personal as it is at home. And then there are a lot of resources available to teenagers that they can, on their own and anonymously, obtain information.
And that's an important point, and that's one of the things that we'll be mentioning at the end of the show are numbers that people can contact. Again, not only teens, but anybody who's sexually active and needs to get more information on sexually transmitted diseases.
And I also think it's very important for teenagers who are going to leave their home, go to college, go to another town, to be educated before they leave, because that's one of the biggest problems, I think, after you've left. It may be that you aren't exposed to that any longer.
And can you address that a little bit? Why is that? Why would your behavior change?
Well, we know that young adults have a very high sexual activity rate, and it's still the age where, as with HIV, you may not be manifesting any symptoms, so you still have that feeling that you're protected, that this is not going to happen to me because you haven't become ill or haven't come down with any symptoms. And so I think it's a very high-risk population. It's when people are experimenting with drugs and alcohol, and they're away from home for the first time, and they have this freedom. And so it's a very high-risk time to start engaging in sexual activity. And having multiple partners, and having partners who may be at high risk for carrying a sexually transmitted disease.
Impulsive behavior can be a contributing factor in contracting an STD. Are teens more prone to spontaneous behavior, spontaneous sexual activity versus planned?
Yes, there's peer pressure, the curiosity of wanting to have sexual contact because you have these urges and desires that are part of adolescence, and we know that alcohol and drugs play a very important role in people having unprotected sex because they're at the moment their reasoning is impaired, and so that is the age where people are experimenting more with these types of behaviors, and meaning alcohol and drugs, and therefore it leading to sexual contact.
Okay. Well, the one thing that I've been skirting today is the issue of condoms. And certainly, if sexual activity is going to go on, one way to reduce the risk of contracting an STD is the use of condoms. Let me go back now to Kenny and Christy. Are you, in your sex education courses in school or in the schools that deal with that, are you being taught about condoms, how to use them, what they are?
Yeah, there is education about ways of protection and methods and everything, but I think it comes down to when it's going to happen. Are the kids comfortable in going out and purchasing condoms? In a town like this where there's the people working up there know your parents, they know you, their daughter's your best friend, and it comes into the question of they're not, do I do it? Do I want to sit here and go in front of these people, or just forget it, I'm invincible, nothing's going to happen to us anyways?
And take the risk. Kenny, do you agree with that? Do you think that it's probably
Yeah.
harder to be anonymous in this town?
Everyone knows everybody, but condoms are, you could get condoms easily, sorta, but
Where
it's
do you-
about using them. Well, you could, because I go to the share station and they have them there, and you could have a friend. I have an older brother and stuff, so it's not really hard for most of my friends, but it's about using them that's the hard part.
Yeah, do you ever get any demonstration of how to use a condom?
Yeah, I've been to a couple demonstrations that's gone through our school where they've showed you how to use a condom and stuff, but
Good. Yeah. 'Cause
So-
that's the hardest thing, I think, is feeling
Yeah.
comfortable that you know how to use them if you ever get in that situation.
yeah.
Well, and statistics confirm that more teens are prone to using condoms if they've been educated on how and are confident in knowing how to use them. Is there a stigma against condoms? There certainly was when I was younger. They were something people wanted to stay away from versus use as a tool. Is that still true today?
Yeah, people just, because they say it takes away the feeling and the pleasure and stuff, but I don't know. It's not worth your life and stuff, so most of the kids are getting that these days.
Kenny, that's a very good point. We talked about methods of diagnosis, and now I'd like to ask you about treatments. Most of us are aware that AIDS or HIV have no known cure at this time, but how can we effectively treat not only AIDS but other STDs? Are there effective treatments out there?
Yes, bacterial STDs, gonorrhea, syphilis, chlamydia, trichomonas, vaginosis, those are treatable with medications. The problem is like with chlamydia and gonorrhea, if you don't diagnose it early and it is allowed to go on, then it can cause scarring, which leads to ectopic pregnancies and infertility later, especially in women. Men can get an infection around part of the testicle that can lead to infertility as well from chlamydia. So they are treatable, but unfortunately, because they can be asymptomatic, you may have irreversible damage before you get diagnosed. The viral STDs are the ones that are more worrisome because we don't have curative treatments. Human papillomavirus is very prevalent. The estimates are up to 38% of women are infected with human papillomavirus. This is the cause of genital warts, and it has been known to increase your risk for developing genital cancer. Men and women can get genital warts. They're very benign looking and may often go unnoticed. They are treatable. They can remove them with chemicals, but they do need to get treated early because they can develop into cancer, cervical cancer in particular. And then there is herpes simplex virus, which is really, there is no curative treatment. There are some medications that maybe help decrease the severity of the illness, but is a recurrent painful disease and can be passed on to your baby at time of delivery, which becomes a life-threatening disease for the infant. There's hepatitis B, C, non-A, non-B, all of which, majority of which may resolve without any long-term sequela, but there is this definite significant percentage that becomes chronic, and it becomes a debilitating disease and can lead to liver cancer. And then there's HIV, which, as we mentioned, there is no cure, is uniformly fatal. There are some medications that can delay the onset of AIDS, because once you get HIV, you may not get AIDS, which is the disease from HIV, for quite a while, and it can delay that, but there's no known cure for HIV.
What about separating some of the fact from some of the fiction about how you contract an STD? I remember some of the mythology that I had in high school was getting it from public toilet seats, getting it from a friendly handshake. Where do you draw the line, and how specifically are STDs transmitted?
You can't get STDs from just casual contact, like from a public restroom or from shaking hands. I mean, it'd be very, very unlikely. It does involve sexual contact. It does not have to be intercourse. It can be just oral sex. Get an infection of your throat, and anal sex. Of course, there's very high incidence of STDs with anal sex because there's a lot of trauma involved in that. And so it does require contact with infected fluids. And the other is, of course, if you're IV drug abusing, then in exchanging needles, that's another way you can get these type of diseases, because they are, a lot of them, bloodborne.
Now, we've heard some of the fact. Can you share with us some of the fiction? Kenny, what have you heard about how you get an STD or how you don't get an STD?
Well, I don't know. I've heard a lot about like toilet seats and stuff and kissing someone, but a lot, like I've gone to like where speakers came into my class and they've asked, "Do you know how you could get an AIDS and stuff?" And most of the students say like they know how you can get it and how you can't. And I don't know, I think the education of that part is pretty good right now.
About how you contract it? Christy, would you agree with that?
Yeah, I think most kids know now that it's not. I think a lot of it had to do with when the HIV and AIDS came out. There was a lot of on TV or anything else telling about how you could and couldn't contract it, and I think that was the message to it was kind of opening the door to education to the extent of here's how you can and can't get a disease.
Dr. Brown, can you share with us what some of the characteristics may be of somebody who is more at risk? Are there certain behavioral characteristics that we can define?
People who are at higher risk for getting a sexually transmitted disease are people who have multiple partners. If you are in a long-term relationship, the likelihood is less that you'll have an STD, although if your partner is also having other partners, then that, of course, eliminates that, because then anytime you have sexual contact with a person, you have sexual contact with anyone they've had sexual contact with. So it can escalate. People who are using drugs are at a much higher risk, especially IV drug abusers or past IV drug abusers. And actually, young women, adolescents, and young adults are physiologically more likely to get an STD because of the vaginal tract is immature and allows the penetration of these diseases more easily. So they have a higher risk for that reason too. And of course, having unprotected sex.
Unprotected sex, of course. We discussed before the start of the show, before the cameras were rolling, that some of the STD numbers have been stabilizing or dropping ever so slightly. AIDS is not included in that number, and AIDS is still escalating.
No, AIDS is escalating, yes.
I've read that, statistically speaking, women now are representing a larger group. Can you explain why that is?
Initially, AIDS was primarily in a homosexual group, and homosexual males in particular. And now that it has become more of a heterosexual disease, it is now becoming much more prevalent in women. That's the best explanation. And do keep in mind that 1 in 4 cases of AIDS is diagnosed in people under age of 22, meaning that they contracted HIV as a teenager.
And can you tell us something about the psychological impact of an STD? What happens to a patient emotionally that's suffering from an STD?
I think it's a lot of denial occurs initially because first you have the feeling that it could never happen to you, and then it's very humiliating to a person, I think, because it's considered kind of a dirty disease, and so they're more reluctant to go for treatment and to tell their partners, because then of course, it may make their partner angry, and so it's a very difficult thing to deal with.
Yes, I would think it would be. To alienate you from socially and in your work environment and from
It would be
people that
something
you love.
difficult to talk to other people about, I think.
Then that brings us to kind of wrapping up this segment and asking you if you could please recite some of the telephone numbers where people may contact. We will also be listing those telephone numbers on your screens so that you can write these numbers down. But if you could recite those
Always
for us.
Call the health department in any community, and they're going to be able to help you with where you can go for help for these kind of diseases and treatment. Actually, they do them at the health department, any Planned Parenthood center, and actually any physician's office. You know, if you want to speak confidentially to a physician, you can do that when you call the office. You say, I just need to speak to the doctor, it's personal, and then they can inform you where you can go for help. There is a National AIDS Hotline number, which we'll give later, and then there's something called Project Inform, which has information on where teenagers can go for treatment of STDs. That's also an 800 number that we'll give you later.
All right, Dr. Brown, thank you. I'd like to thank both of my guests and Dr. Brown for being on the show today. It's not a topic that's easy to discuss. I appreciate your frank conversation and your ability to talk about it with all of us. That pretty much wraps it up. Sexually transmitted diseases are no laughing matter, certainly, and something that we need to be talking about. I encourage you to discuss this with your children if you have teen children. Please feel free to bring it up. If you're not comfortable bringing it up, you may also contact some of the agencies that Dr. Brown has discussed. In any case, let's talk about it. The more education, the more information that's out there, the less likely we are to continue propagating these kind of diseases in our community. That finishes up this episode of Truckee Talks. As I mentioned earlier, we want your input and feedback for suggestions on future topics, and we look forward to seeing you on the very next edition of Truckee Talks. Thank you for joining us.
If I could be a boat, I wouldn't have to worry, sink or swim. I could be right on top and float through this sea of confusion. The wind would not break me, the waves would not take me. I like boats, I like the way they flow. I like boats.
Hi kids, hi mom, hi everyone.
So do you guys know each other at all?
Same way I would be going.
Okay, well we're waiting for the cameras to get set up. I want you guys to think of an animal that has the same letter that your name starts with.
Okay.
Okay, let's go.
Squat.
Wait, let's go around the circle and everybody can tell me the name.
I like boats, I like the way they flow.
Let's let this siren get out of here. Hello everybody, welcome. 2 weeks ago, a young man and his friend on a